Guys, since I heard this thing, my ear has just been scratching me. Because what do you mean that only old people get arthritis? If arthritis was a social club for elderly people, I mean, physiotherapy clinics would be much quieter. Arthritis has no age discrimination. It shows up in children or teenagers or young adults or middle-aged people and elders. There are over 100 types of arthritis, and many of them actually affect young people more. What of rheumatoid arthritis? It's common in young adults. Juvenile idiopathic arthritis affects children. Post-traumatic arthritis happens to active young people after injury. Autoimmune arthritis can hit anybody. So that belief that arthritis is for old people, it's not just false, it's very misleading. But there is age-related wear and tear arthritis. It exists, yes, but that's only one type. Arthritis is not a retirement plan. It can happen to anyone with joint injuries, autoimmune issues, family history, infections, obesity, poor biomechanics, or repeated overuse of a body part. Many chefs, many cook, in their hands, they usually have arthritis on there because they keep using it all the time, In fact, young people with arthritis often suffer more because everybody dismisses their pain. You are too young for arthritis. No, they are not. Arthritis doesn't check date of birth. It checks the joint health. Pain is pain, age is irrelevant. Well, that's myth number one. Myth number two is that joint pain is always due to cold in the body. You see, when I heard this next myth, the thing did me pete in my head. I said, wait, people really believe this thing? That joint pain is always due to cold in the body. Somebody will wake up with joint pain and immediately blame the weather. Like weather is chasing them spiritually. Guys, joint pain can come from overuse, infection, inflammation, sprain, autoimmune conditions, nerve problems. But somehow, when you have joint pain, everything becomes cold entered my body. Cold doesn't enter anywhere. The body is not a leaking bungalow. Joint pain is a biological issue. It's not an environmental problem. Temperature can trigger pain, yes, but it is never the root cause. If cold caused joint pain, every person living abroad will be limping to work now, but they are working fine, are they not? And they are sending you money. The joint is the problem. And this myth makes people ignore the real causes and start boiling water like joint pain response to steam inhalation. Inhalation. Instead of understanding inflammation or mechanical strain, they blame the rain. It's misleading and delays proper treatment. Joint pain has real science, real physiology, real pathology. It's not meteorology. Stop treating pain based on weather forecasts. Treat it based on a doctor's diagnosis. Okay? I was just separating fights this morning between two neighbors. One of them was mad, the other one was crazy. If I tell you the thing they were arguing about, you yourself will feel embarrassed on their behalf. Okay, let's go straight to it. My neighbor said that heat is always better than ice. And the other one was saying that ice is always better than heat when you are treating joint pain or body pain. Sounds stupid, Abby? Okay. So, for the sake of enlightenment, only, not because the argument makes sense, let me even shed small light in case some of you think in the way they are thinking. No shades. But here's the thing. Heat is good sometimes. Ice is good sometimes. Are you happy now? But to use heat for everything, that's how people worsen their injuries. To use ice for everything, same problem. So heat increases blood flow, it relaxes your tissues and reduces stiffness. Ice reduces inflammation, reduces swelling, and numbs pain. But in a fresh injury with swelling, heat will make the pain jump like fuel price. And in chronic stiffness, ice will make the joint lock more. So heat is not universally better. It's simply one tool. It's like saying jollof rice is better than fried rice. Depends on the day of the week and the mood. Your body needs both at different times. If your joint is freshly injured, swollen or inflamed, use ice. If your joint is stiff, tight or chronically painful, use heat. Are we together now? Yesterday along the streets, I heard something that I've never stopped thinking about as a physiotherapist. That a broken bone never becomes strong again. That is a lie from the pit of hell. And that lie has refused to die. But nonetheless, we'll attack it today. Broken bones don't just heal. They often become stronger than the original bone at the fracture site. It shock you? It should. So when a fracture heals properly, the healing tissue called callus remodels into strong bone over months. The body's healing process is powerful. It builds reinforcement around the fracture site, like say you use cement blocks, solidify them. This is why people say that bones heals harder in that area. It's true. Once bone heals correctly, you can do all your normal activities. The only time a bone becomes weak is when it healed wrongly. It wasn't immobilized properly. There were complications, or you didn't follow medical advice. You used native treatments that caused deformity. A medically treated fracture heals strong and stable. So bone responds to stress by increasing the density. That's why rehab is important. So no, your bone is not permanently fragile. It won't snap like biscuits. With proper treatment and physiotherapy, your bone becomes strong enough to trust it again. You can. Okay. By the way, what is this thing I'm hearing that physiotherapy cannot help bone diseases or deformities? Who is saying that? Whoever spread this myth definitely doesn't know what physiotherapy is all about. Because physiotherapy doesn't magically strengthen bones, yes, but physiotherapy absolutely helps deformities to regain function, strength, balance, and better alignment. Many bone deformities come with weakness, stiffness, poor coordination, bad gait or movement, and muscle imbalance, and that is where physiotherapy shines. Bones are structures, muscles are movers. When the structure is imperfect, the movers compensate. So physios help the body to compensate properly, not poorly. It improves joint mobility around the deformity. It strengthens the muscles supporting the area. It retrains posture and gait, preventing secondary complications. It reduces the pain and improves your function. You see, some deformities even improve significantly with long-term correctional exercises, especially in children whose bones are still developing. So, saying physio can't help bone deformities like saying glasses can't help someone with imperfect eyes. They may not change the eyeball shape, but they drastically improve how you use it. This myth is childish, man, and uninformed. Physio is not bone carpentry, it's functional restoration, and function is everything. All right, guys. There's somebody that I'm reserving this blow for. I swear, if I catch the person, oh my God. Because how can you say that aboniki can heal fracture? Aboniki. Guys, aboniki balm can do many things, like confuse your enemies, confuse your nostrils, motivate your spirit, even open your chest. But it cannot heal a fracture. Fractures need immobilization. Biological healing. Aboniki only provides sensation, heat, tingling, smell, and hope. And inshallah, people rub it because it gives temporary relief. But relief is not recovery now. It's not healing. Aboniki cannot enter the bone. It cannot realign a misplaced fracture. It cannot stop bone bleeding. It cannot fuse broken ends together. It cannot reduce swelling inside the bone. The worst part, when someone rubs balm and feels better, they start using the limb too early, worsening the fracture. Balm is topical. It's rubbed on external surface. Whereas fracture is internal. It's like trying to fix Wi-Fi by rubbing the router. Use balm for spraying, muscle soreness, blocked nose, not bone. Fractures need science, not peppermint power. Guys, I have a confession to make. And this one may not sound so good to my colleagues in the profession. But please, it is the truth. And we cannot claim who we are not. Physiotherapists cannot push a dislocated joint back without proper x-ray. It should be illegal. Physios are trained to relocate joints only after imaging confirms it is safe. because some dislocations come with fractures, torn ligaments, nerve involvement, or even blood vessel danger. Guys, trying to reduce a dislocation blindly or to fix it back blindly is like trying to solve a puzzle in the dark. You might complete it or you might break something. Without x-ray, you don't know. If a bone is chipped, if the joint socket is cracked, if the dislocation direction is anterior, posterior, inferior, if there's a fracture that will worsen with movement, if swelling is blocking reduction. Physios are not magicians. They are scientists. They follow protocol, not vibes and inshallah. When imaging shows the joint is clear of fracture, then relocation is safe. But pushing a joint by hand without confirmation is how people get nerve paralysis, artery damage, or permanent deformity. This myth makes physios look like native bone setters. Absolutely not. A good physiotherapist respects imaging the way a driver respects brake. You don't move until you know it is safe to move it. There is something I heard this morning. Cause tell me what you mean that exercise causes joint damage. How? Well, that's not true. Wrong exercise causes joint damage. Exercise in itself is the reason joints stay healthy well into old age. You see that old mama and old papa that you see very active is because they are exercising on a steady basis. See, movement increases lubrication, strengthens muscles, improves circulation, and distributes nutrients in the joint. People who exercise have better cartilage quality than people who sit at home all day. That myth comes from people who jump into heavy workouts with no guidance, no warm-up, no progression, bad posture, and terrible technique, then blame it on exercise. If you load your joints badly, of course they will complain. But when exercise is done right with proper technique, intensity, and rest, joints actually get stronger. So sedentary lifestyle is more harmful to joints than exercise because there will be stiffness, weakness of muscle power, the bone density is reduced, the bones are no longer that strong, you know. Fluid is not circulating well in the joint like a machine should. So do the right exercise, okay? Not the reckless ones. Let me see if I can do. Yeah. So some people believe that this thing I am just doing now, that it causes arthritis. It says I'm doing sweet, Abi. No, it does not. Cracking joints may sound like gunshots, but it is not destroying anything. In fact, that sound comes from gas bubbles that are popping inside the joint fluid, not from bone grinding. So no cartilage is harmed, no bone is damaged, no joint space is reduced. It's simply pressure releasing. If cracking used to cause arthritis, I mean, every child in Nigeria will have knee arthritis by age 12 now, because children's crack joints like saying entertainment. Arthritis comes from inflammation, wear and tear, autoimmune conditions, obesity, and genetics, not from sound effects. So the only time joint cracking is a problem is when it comes with pain, when it comes with swelling, when it comes with locking, like it will lock. It comes with instability. That means there is already an underlying issue, not that the cracking caused it. Okay? So cracking joints is harmless. It's not a disease invitation. Your body is not spoiling. It's just making noise. Guys, some people are looking for my trouble. Because tell me why you will say that physiotherapy damages bones in old people. Let me farabale. Guys, this myth is the reason many elderly people remain weak, stiff, and dependent, because someone told them that movement will break their bones. The truth is, physiotherapy is one of the safest interventions for older adults because it is graded, controlled, slow, and tailored. Old bones don't break from physio, they break from falling down, from immobility, from weakness, and poor balance. In fact, physios actually prevent fractures by strengthening the muscles, improving balance, increasing bone density, and reducing stiffness. Elderly people who do physiotherapy recover faster from injuries. They walk better, they breathe better, and maintain independence longer. Physio is not violence, I see some doctors write referral and say for vigorous physio. What the hell? What do you mean vigorous physio, sir? Physio is not dragging, it's not force, it's a therapeutic movement designed specifically for safety. The exercises are low impact, joint safe, and progressive. Avoiding physio is what increases fracture risk actually. But doing physio is what reduces it. Bones love controlled stress. That's how they stay strong. Physio protects old bones, it doesn't damage them. How does a child learn to walk? By walking. If a child stops walking, his walking is impaired. How do you make a muscle to become stronger? By loading it with more weights. How do you get a bone to become stronger? By loading it with more weight. It adds bone minerals and the mineral density becomes more. Truly, guys, I need your support. By subscribing to this channel, by just hitting the subscribe button for free, you are supporting me, because then more people will see my videos. If you also hit the like button, more people would see the video. If you also comment what you think about the video or what you'd like me to talk about next, more people will see the video. By so doing, you are helping me, you are supporting me. If you love what I share, what I talk about, please share it with others. Okay? And remember to follow, remember to subscribe, remember to share it with your friends, guys. I love the support, I love the love, and keep it going, keep active, keep moving, and I will talk to you next time. Ciao!